Kat, special programme, BBC One tonight on Inside Out, presented by Kat. Kat's been on a very personal journey to help her make a decision on whether or not to get tested for the disease which killed her mum. We're talking Huntington's disease this morning. I know, I can imagine it's very difficult to just talk so openly and honestly about it, is it?
No, not really, because my mum lived with Huntington's for a long time. She was diagnosed when I was around 11 years old, and I was the eldest of 4, so my youngest brother was just 1 at the time. Huntington's disease is a genetic disorder, and it's passed on through your genes, and you have a 50-50 chance of inheriting the gene that means you would go on to develop Huntington's disease. Now, it normally is passed down the family, or it can mutate, and we think that's what happened with my mum, so she didn't know that it was on its way. So it was a bit of a bombshell, I think it's fair to say, for my mum and dad, and having 4 young children at the time, but they were always really open and honest with us about what was happening. And Huntington's I've seen described as a mix of Parkinson's disease and Alzheimer's and motor neuron, because it affects the nerve cells in your brain. So it attacks the different cells in your brain, which, the best way of putting it for me is, everything you learn as a child and as a baby, you then unlearn as an adult, and it's quite a slow progress. My mum died around 15 years after she was first diagnosed, when she was 54 and I was 24. And it's a condition that, as I say, gradually gets worse. So you end up more and more disabled. You can't speak, or my mum struggled to communicate. You can't really walk. In the early stages, you might be mistaken for being drunk because it affects your motor skills. So actually, you might look like you're staggering when you're walking. And it's 10 years since she died. So I decided to sign up to do the London Marathon, because my parents were very open with us when we were young, and we've grown up knowing that there's a 50-50 chance of inheriting this disease. And I was completely fine until I was in my 30s. I thought, oh, it's fine, I've had a great life. And despite how potentially awful the disease sounds, we had a great life. We had a great childhood. My dad especially is brilliant, and he's did all the caring and the cooking, and we grew up very loved and in a very secure family unit. And so I just thought, oh, it's fine. And then I turned 30, and in my 30s I suddenly thought, well, she was in her 40s when she was diagnosed, and I'm in my 30s. Oh my word, the clock is ticking. And so I just thought, this is it, right? What should I do? Because if I have got this disease, then what will I do? Because I want to do well in my life. I want to try hard. And then I think, if I have it, would I just sit on the sofa and give up?
Do those symptoms always come on later in life, or can they come earlier?
They tend to come on in your 40s. It can be later. If you get it much earlier when you're younger, it's called juvenile Huntington's disease, which is different. It tends to be more severe. So you sufferers tend to, you live a completely normal life, and then it hits in your kind of mid-40s or slightly later. So for my mum, she was diagnosed quite early because her dad had MS. And I mean, he lived till his 90s, but she thought that maybe when she was riding her bike and she was perhaps not that steady, she thought that could be MS. And she got the tests. After a number of tests, it was revealed it was Huntington's disease. So I grew up, after she died, I was 24, I went into journalism. And it's not that I didn't talk about her, because if anyone asked about my parents, I would always say that my mum had died. But I suppose I didn't really talk about it really openly, in terms of, for me, it was always something that had already happened. And I always struggled with, when I told people the fact that there was this test that would tell me if I would inherit this disease, I struggled, because lots of people on hearing the news say, well, I'd want to know. Why don't you just get the test and then at least you know? And I always really struggled with that, because I thought, actually, until you see someone live through this and see what it does to your life, your social skills, one of the things I like most in life is eating, and actually it slowly destroys your ability to chew properly and swallow, so you end up choking. And we used to have to puree my mum's food, and she would still enjoy a beer or a wine, but you'd have to thicken it with a special thickener so she could drink it and she wouldn't choke. So I think I would struggle with that, and I think actually I don't really need that kind of input from different people. But I suddenly thought, it's the 10 years anniversary of when she's died. I want to do something brilliant to raise money, but also to challenge myself, because I'm not a runner. I've always said this. I've never been particularly sporty. So I thought, well, I'll sign up and do something great. And then if I do have this condition, I will have achieved something kind of strong with my body.
Now, we'll learn a lot more about it tonight on BBC One on the Inside Out programme. Who have you been speaking to for that?
So I've spoken to a number of people over the past couple of months I've been filming. We've been driving around the country. I've been to see people who were all affected with Huntington's disease in one way or another. Either they themselves have it or their parent has it and they're at risk. And it all fell into place beautifully, because I'd started filming and I was looking for one more person to speak to, and then out of the blue one day I got contacted by a lovely fella called Damien. Damien Lodge is 58 and he lives in Handsworth, and he said, I've seen that you're raising money for Huntington's, and let me tell you my story. And so I went to see him in Hillsborough Park.
Hi, my name is Damien Lodge. I am 58 years old. My dear mum had Huntington's, which came on when I was born, and she passed away when I was 22 years old.
And you contacted me because you saw the marathon training that I've been doing and me speaking more openly about Huntington's disease. What was your experience of it growing up?
It was hard, really, because I am the youngest of four. My brothers and sister were always telling me how good my mum was and how gorgeous she was, and all I was seeing was her gradually getting worse with this illness. And she was my mum, and she doted on her youngest, and I didn't see any different. But obviously in later years, as it kicked in, it just got harder and harder. She was good at first, but she became very inverted, sort of her personality disappeared. Before I was around, she was a great seamstress, cook, everything that everybody told me, but I didn't see any of that because the illness had kicked in. And really I was looking after my mum as opposed to my mum looking after me. But it was tough, but it was what it was, and you live with it, as I'm sure you know.
It used to be called Huntington's chorea because the chorea means involuntary movements. I don't know if your mum did this, but my mum, she would go to put a cup on the table and involuntarily fling it off the table. So in the end, she ended up using what were essentially children's beakers, but designed for adults. So they had two handles, almost like a sippy cup. And then she'd have to wear a plastic bib because she'd get food everywhere, and then she'd start choking. And if you took her out, you'd have to be really careful about chopping her food up. Certain things she couldn't eat because she'd end up inhaling it, and then you'd have to pat her back, and then sometimes she might be sick. So as a teenager, coupled with the fact that no one as a teenager likes their parents, we have this to contend with as well, and it's just a different way of living.
Yeah, it is. The description you just given was ultimately how my mum ended up, where your functions you can't control, your toilet habits, your eating habits, how you'd normally eat, and involuntary movement is something which I remember distinctly.
What you say really chimes with me in terms of I grew up not really knowing any difference. So my mum was, I was about 11, 12, 10 when she was diagnosed, and she died when I was 24. And you grow up, and it's not till you look back and you think, actually, other people didn't have to help their parents get dressed or go to the toilet, or you'd have to look after them and make sure that they were okay, that you suddenly realise that this is something that actually is quite difficult. And then coupled with the fact it's a genetic disorder, so you and me have got a 50-50 chance of getting it. What were your thoughts when it came to taking the test to determine whether or not you had the gene?
When I was younger, I was adamant I was going to have the test, whereas my brothers, my sister said, you crackers, you don't want to do that, it's like a life sentence. But I was going to do it, and at the 11th hour I was talked out of it. And now that I'm an old man, I'm glad I didn't do it, because one of my other brothers didn't have children purely because of the chances of it passing on, and which is a crying shame. Whereas my other brother Chris and my sister Molly, we've both got kids, and I've got kids as well. So I didn't want to have the gene test, and the more I think about it now, I must have been foolish even contemplating it, because if I was told that I got it, my life could have been totally different. And no kids, I just don't know, but I wouldn't entertain it now.
And as a bloke and as the youngest in your family, How have you dealt with your feelings and your emotions around Huntington's disease?
Do you know, Kat, until I saw you were running for it and raising money for it, you don't see it publicised very often. You don't see it out in the open as much as cancer and dementia and whatever. And I think it's something which ought to be publicised more. I've not really thought about it as much until recently, when my sister's been diagnosed with it. We would always have the thought that once you got past 50 years old, the chances of you getting that illness had passed. But Molly is in her 70s and she's got it, and she's dealing with it. And obviously medication has improved since my mum was around, and she's dealing with it better. But you can see the signs, and I can see similarities between Molly and my mum, in appearance and everything else. So it's not a nice illness.
So that's Damien Lodge chatting to our very own Kat Harborne there. More about it after 8 o'clock this morning on Breakfast here at BBC Radio Sheffield. And the programme tonight, Inside Out, it's on BBC One at 7:30.
Family means sharing a moment.
Raising a glass.
Now on Breakfast this morning, a story involving our own Kat Harborne. Kat is talking about the possibility that she carries the same disease that claimed her mum's life. It's known as Huntington's disease. It's an incurable hereditary disorder of the central nervous system. The chance she has it is 50-50. Tests are available to find out if a person has it. The story on our Breakfast show, it's also on Inside Out on the telly at 7:30 this evening. Kat's father, David, recalled breaking the news of her mum's condition to Kat and her siblings.
It was hard. Because clearly, even though we told you the truth of what was going to happen, actually living through it and understanding it are two different things. And you're right, it is a disease that takes a long time to fully unfold, and your mum lived for another 12 and a half years after the diagnosis.
Now, as we've been hearing, of course, you can see our very own Kat Harborne on telly tonight on BBC One, 7:30 on Inside Out, exploring whether or not she should take the test that would tell her whether or not she's got the genetic condition Huntington's disease. Her mum, Jeanette, died when she was just 54. Kat was 24 at the time. The programme's on telly tonight, as I mentioned, 7:30 on BBC One.
It's 10 years since my mum Jeanette died from Huntington's disease. She was 54 years old. To mark the anniversary, I'm going to run the London Marathon this year. Huntington's disease is a rare degenerative condition that gradually kills off healthy nerve cells in the brain. In short, it robs you of everything that you are. There's one question I need to know, but have been too afraid to ask. Am I going to die from the same disease that killed my mum? I have a 50-50 chance of inheriting the disease. There's a simple test to tell me if I will get it. I've been on a journey to meet people who I hope can help me make the decision about whether or not to take that test. People like my dad. Should I take the test?
I'm absolutely not going to tell you what to do. It's not my decision. It has to be yours. Sorry, sweetheart.
While I was training for the marathon, I bumped into Duncan Smith from Hull. He has the disease and is on a clinical trial aimed at eventually finding a cure.
38, 31, 24.
Duncan's been on a medical trial for 3 years. He's been receiving a new drug and carries out a daily routine of tests to determine his reactions, coordination and balance. The data from all those on the trial is uploaded to a centre in Belgium for evaluation. I caught up with him at home in Hull a few months after we met on the run in York.
Duncan, hello! I have to go to Manchester every month for this lumbar puncture. And they put this new drug in your spine, completely new, first drug ever tested on humans, and it seems to be working.
What do you think? Should I have the test?
Yes. Well, if you've not got it, then you can carry on that, but if you've got it, then, yeah, there's a choice now.
The drug Duncan's on is experimental and expensive, but doctors are hopeful that it may be able to halt the progress of the disease.
Kat Harborne there, and of course you can see more, as I mentioned, BBC One on Inside Out, 7:30 tonight. Now, one woman who knows exactly what Kat is facing is Mel Pearson from Sharrow in Sheffield. Her mum died from the disease when Mel was in her 20s, but I'm pleased to say she's in the studio this morning. Good to have you with us, thank you.
Hello.
First up then, you didn't know, as I understand it, you didn't know Huntington's disease was in the family when your mum was diagnosed, did you?
No, we just, we weren't quite sure what was going on with my mum. She started to develop all sorts of very nervous tics, and it was very hard to sit next to her on the settee watching TV with a cup of tea. And then they got worse and worse, and she started having falls, quite odd behaviour, really like dementia. Absolutely irrational furies, throw things at people, and gradually she lost the ability to hold that cup of tea in the first place, and went through a lot of neurological tests, at which point we heard that it was Huntington's. None of us had ever heard of it or knew what it was, so it was a bit of a shock to the system to find out that it is hereditary. And because obviously her father had been an RAF pilot in wartime, and my granny's other side of the family, a lot of people had also died in the war. It was very difficult, when a lot of men died in that previous generation, to be able to trace it back to say, oh well, so and so must have had it too. So that time with two significant wars wiping out a lot of men meant that I think it did hide the hereditary pattern of Huntington's.
And that's just one of the many very cruel aspects of it, isn't it? It's the fact it doesn't actually manifest itself until middle age.
That's right.
By which time most people have had kids and passed it on.
Yeah, and also you're in the middle of living a life, so there's a lot of things to, a lot of people who will be affected. Yes, and if you don't know that it's there and you have had children, then you've handed them a baton, really, like a family curse, and people do call it a family curse, and in many ways it is, I'm afraid to say.
Just talking about your mum for a second, when that news broke, I mean, how did you find out? How did you take that news?
I think my dad took it all on pretty much single-handed, because he read all the literature immediately. And in those days, which would be, the late 70s, early 80s, there wasn't that much literature either. There wasn't anything like the amount of knowledge.
Until you get these days, yeah.
Yeah. And I think he read it, and I think he really tried to protect me and my brother, because we were both teenagers at that point. I was maybe in my really early 20s. I was at university. And we were a little bit, I don't think we could quite take it on, because it just seemed like something so far off. But I think I did take it on subconsciously. So although I just went on living
your life,
and we'd been advised to do it,
it's in the back of your mind all the time.
Oh yeah, definitely.
When did you start thinking, shan't I take the test? That must be a massively difficult decision.
Well, the test was only available, excuse me, in the mid-90s. So it wasn't even a thing then. It was science fiction, really. Right. So it was a very new thing. It was the first one of all the possible genetic tests we can get now. I think I started thinking about it probably around about Kat's age. I think it is the age where you do start just in a way thinking about, well, what's next? And I realised that although I was living a brilliant life in lots of ways, I was single, I was fairly rootless, I was working in the film business, and I realised I just wanted to know that there was something that I'd kind of got on hold. And I knew that subconsciously I'd got something on hold. I'd never thought I would have children. I'd made very sure that that wasn't even in the conversation. So it wasn't about that. It was just about, I know that I've got some kind of...
It's unresolved.
...cork in the bottle.
Right, yeah.
And I just want to know. And it was... I know it sounds cheesy, but it was to do with living my best life. It's like, look, if I've got this waiting for me in another, 15, 20 years, then let's really go all out. You know, what would I like to do with my life? Well, I'd like to do this and that. And so I had all that conversation with myself and booked myself in for the test. And I was very, very lucky because I had the most incredible support system.
Right, I was going to ask you actually whether or not you had people who could understand what you were going through, who would be able to help you.
Do you know, I don't think anybody can really understand unless they've been through it themselves, because I think there's something very traumatic about the hereditary factor, where you've seen somebody go through this very, very ugly and unpleasant. It has been called the worst of all the neurological illnesses rolled into one. Everything is just completely destroyed in as the brain deteriorates, and you have to watch that person going through it, and to know that that's in the post. In my case, for me or my brother, because there's a 50% chance of getting it from the sibling, or me and my brother, or maybe neither of us. There's a level of trauma that I think is very special, and so not many people did understand. But I tell you, lots of people were just astonished that it was possible to have a test to tell you.
You were in that situation really with your brother Nick, who sadly passed away, of course, last year. He had Huntington's. What was his attitude to taking the test?
He was really different from me. I think we were both quite fatalistic.
Right.
And I never knew this till much later. I believed that out of the two of us, it would be me. And he believed that out of the two of us, it would be him. And it was one of the things that we couldn't speak about, because we were very close and we talked about everything. But it was one of the things that was just slightly in the way. We both took it on ourselves, I think. And he just didn't want to. When I was going through the process and the testing, as you'll know from Kat's journey, it's a long process. You have to start with a lot of psychological tests to make sure that you can, you're robust enough to hear bad news. He decided he just didn't want to, and he always said that he knew he would have a bad reaction to bad news and that he would kill himself. Right. And we didn't want that. So, and he had a very flamboyant life. He was working in hotels. He had, I think he was settled down with, I think he'd certainly got a baby on the way when I had my test, and he just didn't want to do it. And I genuinely think that we were both right. For us.
In your own circumstances.
Yep.
Yeah.
Yep.
You're 60 now, if you don't mind me saying.
Yeah,
I'm
right?
60. What's your advice to Kat looking back about stuff you've learned?
I think that sense of things being on hold is probably always going to be there with a diagnosis like this in the family, because I know that she's got brothers and sisters. So it's with Huntington's in the family. If you are clear, if you test negative for it, chances are somebody you love very dearly is going to get it. You're either, I know it sounds harsh, you're either the person who gets it or you're the person who watches it. And with that in mind, that whole thing about me waiting for, a kind of sign to live my best life, I think you have to do that anyway. You just, whatever the result is and whatever you decide whether to take the test or not, it's kind of a call to action, and just to make the most of it, because none of us know, even without
what's
a deadly illness in the mix, none of us know. So that's my Monday morning bit of advice.
Mel, good to speak to you. I really appreciate you coming in and taking the time to talk about it. I really do. Thank you very much for coming in. That's Mel Pearson from Sharrow in Sheffield, and as I say, Cat Story on BBC One Inside Out, 7:30 this evening.
Dementia and Me, a new podcast from BBC Radio Sheffield.
We sing The Wonder of You.
Over the River Don there.
until 10. The phone-in is on then this morning. I'm asking you whether or not you would take a test that would determine your future. I mean, there's so much to talk around it, isn't there? Would you think, it's better off not knowing? Or would you think, you know what, no, I want to live life to the full, knowing what's down the road? The trouble is, do we ever know what's round the corner? I suppose that could be argued. We don't. 81333. Start your text with the word Sheffield, please, or you can call us on the usual number. It's 0800 111 49 49. I'm asking this because Kat's made a film for BBC Inside Out tonight, BBC One, 7:30, which is all about whether or not she will take the test to find out if she's got the inherited Huntington's disease, which killed her mum. Now, Huntington's is not the only illness with a genetic test. There are plenty of others out there, of course, and you can have a test to see if you've inherited a gene that means you're more likely to get breast cancer, and you can act on that. There are talks about a genetic test for dementia. There's a whole range of things out there, but would you? That's the big question this morning. 81333. Start your text with the word Sheffield. Would you do it? Do you want to know what your future holds? Or maybe you've actually taken a genetic test. It'd be good to chat to you about that, how you dealt with the answer that came through. You know my number. It'd be good to hear from you. 0800 111 49 49. As I mentioned, Kat's piece Inside Out tonight at 7:30. Here's just a little taster.
It's 10 years since my mum Jeanette died from Huntington's disease. She was 54 years old. To mark the anniversary, I'm going to run the London Marathon this year. Huntington's disease is a rare degenerative condition that gradually kills off healthy nerve cells in the brain. In short, it robs you of everything that you are. There's one question I need to know, but have been too afraid to ask. Am I going to die from the same disease that killed my mum? I have a 50-50 chance of inheriting the disease. There's a simple test to tell me if I will get it. I've been on a journey to meet people who I hope can help me make the decision about whether or not to take that test. People like my dad. Should I take the test?
I'm absolutely not going to tell you what to do. It's not my decision. It has to be yours. Sorry, sweetheart.
While I was training for the marathon, I bumped into Duncan Smith from Hull. He has the disease and is on a clinical trial loaded to a centre in Belgium for evaluation. I caught up with him at home in Hull a few months after we met on the run in York.
Duncan, hello! I have to go to Manchester every month for this lumbar puncture, and they put this new drug in your spine, completely new, like first drug ever tested on humans. And it seems to be working.
What do you think? Should I have the test?
Yes. Well, if you've not got it, then you can carry on that. But if you've got it, then yeah, there's a choice now.
The drug Duncan's on is experimental and expensive, but doctors are hopeful that it may be able to halt the progress of the disease.
Kat Harborn there, and you can hear all of her story this evening on BBC One. Inside Out is where you'll find it 7:30 this evening. Now let's speak to Dr. Jane Spink on BBC Radio Sheffield. Jane is the CEO of Kat Harborn there, and you can hear all of her story this evening on BBC One. Inside Out is where you'll find it 7:30 this evening. Now let's speak to Dr. Jane Spink on BBC Radio Sheffield. Jane is the CEO of Genetic Alliance UK, which is a national charity working to help people who've been affected by genetic rare and undiagnosed conditions. Good to speak to you, Jane. Thanks for joining us this morning.
Good morning, Rob.
I'm just interested in knowing what your take is on how many people across the UK are kind of in a situation where they have the opportunity to look into the future, really, and take a genetic test. There's many different conditions, isn't there, that are genetically dominated?
Yeah, so around 7,000 rare diseases, and about 80% of those have a genetic component. And as well as the 3/4 of those which develop in childhood, there are genetic conditions where the symptoms become apparent in later life. And for those conditions, it could be possible to take a predictive genetic test. And so there are people with a range of family histories of various rare diseases who might be considering whether or not a predictive test is the right way for them to go.
And what are the pros and cons? I mean, there's the obvious knowing and not knowing, isn't there? But there's so many other complications around that decision, aren't there?
Yes, and I think that the detail of what those risks and benefits are going to be depends very much on the condition that you're considering having a predictive test for. So, for example, a predictive test might mean that you're able to take advice or treatment from your doctor to help lower your risk of developing a condition. Or it might mean that you can take decisions about how the next generation would be affected if you test positive. So, for example, in the case of conditions like Huntington's, if you're thinking of having a family, if you speak to your GP, have a referral to a genetic counsellor and obtain a test, then you have choices around reproductive choice that can ensure that the next generation is not at risk of developing that condition. And one of those choices is through pre-implantation genetic diagnosis, where you have IVF and test that the embryo doesn't have the Huntington's disease gene before it's implanted. So there are a range of sort of considerations ranging from perhaps access to preventative measures or early treatment right through to considerations of, for family members and for the next generation. And it's very specific to you as a choice and very specific to the condition.
Tell us a bit more about what you do at Genetic Alliance UK, because I would imagine advice must be very hard to give.
So at Genetic Alliance UK, we're an umbrella organisation, and we're an alliance of over 200 voluntary organisations who variously provide support, fund research and provide information for individuals and families either affected by or at risk of genetic conditions. And one of those is the Huntington's Disease Association. We also are home to Rare Disease UK, and we campaign for better outcomes for all those affected by rare genetic and undiagnosed conditions. And we're also home to Swan UK, which provides support to families who have a child or young person with complex needs but no diagnosis, but a likely genetic origin for their underlying condition.
Is it possible to give advice as to whether or not someone should take a test of that kind of magnitude?
Well, I think what's really important, and the most important thing, is that if you're worried, if you've got a family history of a genetic condition and you're considering, would it be a good idea for me to get a test? How do I feel about that? What should I take into consideration? Then I would say speak with your GP and ask for a referral to a genetic counsellor. And before you're offered this genetic test, you'll have several appointments with the counsellor, and all the benefits and risks will be explained. And if you decide to go ahead, then you'll have support around the testing and outcome of that test. And I think that's really a very important thing that people should do if they're considering whether or not a test is right for them.
All right, Jane, good to speak to you this morning. Really appreciate it. Thank you very much for joining us. Appreciate it.
Thank you. Okay,
That's Dr. Jane Spink there from the Genetic Alliance UK organisation, as I say, a national charity involved with working over 200 patient organisations, talking about genetic rare and undiagnosed conditions in particular. Morning, good to have you with us. It's Steve taking you through to 10 o'clock this morning. I'd like to know, please, whether or not you would take a test that could predict or determine your future. Let us know.
Remember us alone. It's just home.
We're asking that, as I mentioned, BBC One Inside Out tonight. Make sure you love that Years and Years and Shine. Now, actually, with Amy Taylor, who's a consultant genetic counsellor at Adam Brooks Hospital down in Cambridgeshire. Good morning. Good to have you with us, Amy.
Good morning, Steve.
So just take us through the process of this, because it must be very, very difficult to broach that subject and then to tackle it from a counselling point of view.
Yeah, I mean, I suppose the first thing to say is that we don't see everybody in this situation. We only see the people who are interested in testing. So we know that, particularly with Huntington's disease, at least half of the people with a family history choose not to be tested. And some of those people won't ever come and see us because they've made that decision. Sometimes maybe the information hasn't been passed on to them by their family members either. But when we do see them, we take it quite slowly because obviously, as I think you've been talking about, there's a lot of things to weigh up and consider, and it's a really personal decision for each person.
So what is it like for patients then when some people say, oh, just have the test? Because there must be a lot of people who aren't in the situation for whom the decision's actually very clear, but when you're in that situation, it's earth-shatteringly big in terms of magnitude, that decision, isn't it?
I think that's really true. I think from the outside looking in, a lot of people think, well, why wouldn't you want to know? That information's there, you can have it. When you're in that situation, and particularly when you've got a family history and you've seen a loved one deteriorate with the symptoms of Huntington's disease, the possibility of looking into that crystal ball and thinking that could be what happens to me in future can be a really terrifying one. And there are reasons why some people do choose to be tested. Sometimes they prefer to have that knowledge to be able to plan their lives around it, think about what career they might take, think about doing things at the right times before their symptoms kick in. Sometimes it's about planning a family, because there are things that we can offer to people if they're thinking about starting a family and they know that they've inherited Huntington's disease, to make sure it doesn't get passed on. That's often a strong driving force behind people being tested. But that doesn't apply to everybody. For some people, they do feel that it's better not to know, to maintain. I think the kernel of this is, if you don't know, you can maintain the hope that you don't have it. Whereas if you find out and then it confirms that you do, then that hope gets extinguished.
Does there tend to be a 50-50 split in terms of people who do and people who aren't sure about having tests?
Well, we think so, but of course that's quite hard to measure because, as I say, we only see the people who are at least thinking about being tested. So people who get as far as a genetics clinic, you mentioned process, how our process works is we'll see people for a first appointment. We never do a test at the first appointment for Huntington's disease. That's an appointment where we explore with them their knowledge and their understanding of and their experience of the condition, what's brought them to thinking about being tested, and work through with them the things that they need to be thinking about and weighing up. We then they go away, and we don't organise a follow-up appointment unless they recontact us. So at that point, it's completely in their hands to come back if they want to take it further. So we know about the people who decide against it at that point, the ones who come for a first appointment and don't come back, and that's maybe a third of the people that we see. But we don't know about all the people who are so certain they don't want to know that they don't even get as far as coming to see us.
Must be an incredibly challenging but rewarding job for people like yourselves as well, to be doing such a high-pressure job, really, in a way.
It is. Well, yes, it's both of those things. It is extremely rewarding because it's a privilege, really, to have these conversations with people at pivotal points in their lives where they really share a lot of personal information and really you're exploring some kind of deep thoughts with them. It's a real privilege, and Giving the results is obviously a big moment for us and for them. By the time we are giving the results, we've met them a couple of times. Often we'll have had a few phone calls. We know these people really well. Of course, we wish for good news for everybody, and it's such a delight when you're able to give somebody a good news test result. But when you give bad news, what we own there is doing it in the best possible way, so making sure that we've prepared someone as well as we possibly can, and that when we give them that news, we give it in the best possible way, even though it is a terrible thing to hear.
And what kind of support structure are in place following the test result?
So as part of the pre-test process, we will have explored with our patient what their support structures are. So we'll have talked with them about who are the people that they're going to tell about going through testing, who are the people that they want alongside them actually in the room, who are the people that they are going to talk to and lean on afterwards. We'll make a plan with them about what they're actually going to do when they go home. We'll usually then plan at least a follow-up call with them, and often, particularly if we've given a result that shows that they have inherited it, we'll also plan a further follow-up appointment to check in with how they are. Longer term, so there are specialist Huntington's disease clinics. So there is one here at Cambridge, run by Professor Roger Barker, who's extremely experienced. And every report we hear of people is when they go and see him, they feel in really good hands. So he'll see them and examine them, and often at that point they don't have any features of Huntington's disease, but they feel very safe in his hands, and they know that he'll look after them when they do start to develop symptoms. And his clinic is also the route into research, so there are trials and treatments being investigated for Huntington's disease, and sometimes that's a factor actually for people being tested. They want to be able to contribute to research and knowledge, but also kind of be in early when any treatments are being trialled. So kind of longer term follow-up there within that clinic, and there is a support group called the Huntington's Disease Association. They're a really proactive support group, and they actually employ people as liaison officers, so people who are present at those clinics but also go and visit people at home as well who are affected by Huntington's disease.
I see. Amy, good to speak to you this morning. I really appreciate you taking the time to chat. That's Amy Taylor, lead consultant genetic counsellor down at Addenbrooke's Hospital, talking about the process really of going through leading up to making that decision as to whether or not you would. BBC One tonight, we're talking Inside Out, 7:30, Kat Harborne's story about Huntington's disease and whether or not to take the test to find out if she's inherited that disease, a disease which killed her mum. Dr. Marion Sloan is a GP from the Sloan practice in Sheffield, which covers Woodseats and Mearsbrook in Sheffield. Morning, Marion. Good to have you with us.
Thank you. Good morning.
I mean, being a GP, you cover all ranges of things. It must be extremely delicate when someone comes to you with a dilemma as to whether or not to take a genetic test like the one we're talking about.
Yes, it does. It's very, very difficult, and it's a Pandora's box because you want to know but you don't want to know. You're afraid of looking in the box for fear what might find, but the relief that you would get if you don't have the disorder is immense, so the temptation to take the test is huge. It's very difficult. The questioning time often coincides with adolescence, emerging sexuality, and you really don't know what you think about your own self, let alone any children that you may have in the future. And I think that, to me, is the key. Whatever the die is cast, you've either got it or you haven't. So that's for you personally. But in terms of what you might pass to your children, I would suggest there's another dimension there that needs thinking through very carefully. Do you wish to go blindly into parenthood, potentially passing this gene on? It's a 50-50 chance. If you've got it, they'll get it too. And is that what you want to do in terms of social responsibility?
So how do you deal with then when a patient comes to you and says, look, I'm considering this, or I'd like to take a test? I mean, I'm presuming you can't give advice, so to speak, can you? Or is it more about, posing certain scenarios and weighing up a balanced argument for them to make up their own mind?
At the end of the day, they have to make up their own mind, but there are specialist teams of genetic counsellors, and really this is the go-to point.
Right.
The genetics department in Sheffield is second to none. They are fabulous. They can work out a family tree. They can talk about risk. They're used to talking to people with real lives and real problems. And if somebody came to me with that question, I'd say, look, don't mess with me. Let me pass you on to a specialist who can really help you and support you to make this decision. It's a life-changing decision, and you need to feel supported in it and after it.
Is it a common situation you find yourself in?
No, it's very rare. It's very rare. I've been here more than 30 years now, and we've got probably 2 families that I have known. But it's a tragedy. It's a lifelong tragedy. It's a life-changing thing. Sometimes it bobs up out of the blue and you think, where's that come from? Because although it's genetic, sometimes people aren't very sure who their parents were, if I can pose that one gently.
Yeah.
Sometimes it's very clear that if your mum has it, then you've got a 50-50 chance of having it as well. It can, because of the 50-50 thing, it can skip a generation, so if it's in your family, you don't know if you've got that or not. There is risk in there. And it often comes to a head at a time, well, there's never a good time for anything like this to come to a head, is there? But it often comes to in adolescence because kids are questioning everything in life, and that is a biggie. Yeah.
So
I would say seek specialist advice.
Yeah, and after they've sought that specialist advice, and they have had a test result. Do you see people afterwards as well, or are they still? Is there still like an aftercare process from the counsellors?
Yes. I mean, they're still the same on Wednesday as they were on Tuesday. They've just got this extra piece of information. It's a very peculiar disease, is Huntington's, and the signs and symptoms do not emerge until people are in their 50s, by which time they've often had their family, and the next generation has been determined what genetics they have or haven't inherited. So you have an absolutely normal life until your mid-50s potentially, and then unfortunately it's a progressive downhill, stepwise drop after that.
And just finally, treatment-wise, Marion, how do you go about prescribing that treatment? I mean, what is there effectively to manage it?
It is supportive. It's a chronic neurological disorder, so there is huge support in the community, the teams of district nurses, neurological practitioners, the home care service. People often live very fulfilling and satisfying lives until the very end, when they become very disabled. Once that point has been reached, then a care situation. But you might say, well, a lot of people when they get into their 70s are in a care situation. So life can be optimised, but nevertheless it is a big burden to carry.
All right. Dr. Marion, good to speak to you again. Thank you very much for joining us. Appreciate it. That's Dr. Marion Sloan, GP from the Sloan practice in Sheffield, which covers Woodseats and the Mearsbrook areas of Sheffield. And you'll see Kat on the telly tonight, of course. Kat, as I say, it's been a fascinating insight to people who don't really know about that.
I think it's really important as well. I think it's easy to listen to the doctors and the guests that we've had, and even the report that I've done, and think, God, this is so depressing, this is awful. But actually, what I would like to say about this is, yes, my mum died when I was 24 and she was 54, and that's not the life we would have chosen for any of us. But within the life that she had when she was getting progressively worse, we still had really good times. Anyone who cares for anybody else knows that yes, there are hard times, but sometimes it's the joy in the day-to-day life. My mum really liked going to the pub. I spoke on Friday about the time my sister and I took my mum to the skate park and pushed her down the skate ramp, and she fell out of her wheelchair. And we had a real laugh about this. And I think one of the reasons I never speak about it, or I didn't used to speak about it, is because I find it really difficult when people do that sympathetic kind of sad face thing, because actually I have a life to live, and yes, I might get to the age of 40, 45 and start developing symptoms, and yes, my life will be shorter than it would be otherwise, but that is something I have accepted and got used to. And I think, as cliche as it is, it forces me, my family, and hopefully it will make other people think, let's live the life that we have now. Let's make those decisions. Let's go on those trips that we've always wanted to go on. And this is partly why the Naked podcast was born. Why am I sitting here worrying about how big my bum is when my body might end up being very disabled? So that was why, part of the reason anyway, the Naked podcast was born. And I think my key message, if anyone is facing anything to do with genetics or a genetic illness, is it doesn't define you. It doesn't mean that this will be your only future. Yes, it might look different than you'd planned, than you'd wanted, but there's so much life to live. And I think when you hear it spoken about as degenerative and progressive, I think it does seem quite scary. But I think there's a message for all of us of actually, if there's a life that you want to lead or something you want to do in your life, get on and do it now, because none of us know what's going to happen. Yes, there's a test that could tell me what might happen to me, but I also don't know, I might have an accident or anything like that. So I think hopefully there's something we can all learn from that.
All right, tonight, BBC One, 7:30. We'll look forward to seeing it. Thank you very much, Kat. Kat Holborn, who's back with you tomorrow on Breakfast, of course. Last up from us, ahead of Paulette, though, at BBC Radio Sheffield, Harry Styles.